The coronavirus pandemic has affected many industries in Africa, from transportation and education to the food and beverage industry. In an attempt to stay afloat, many businesses have been adapting to new ways of working, but this has caused unprecedented disruptions to economies and labor markets. Today, we analyze how the pandemic has affected transport in our special series focusing on how the continent is coping with the impact of COVID-19. Well, on to our continued series on Africa fighting COVID-19, we shift our focus to ambulance operators. These are the unsung heroes in everyday emergency response efforts. In our next story, our reporter Nick Mudimba shows us what a work day is like in the life of an ambulance operator in Kenya.
It's 6 a.m. in the morning and Joshua Ndungu is getting ready to face the day. After his wife serves him breakfast, it's time for the ambulance operator to bid his family goodbye and head to work. As the streets of Nairobi slowly come to life before the morning mist settles. After arriving at his workplace, his first stop is the dispatch center. Here, Joshua gets briefed about his area of coverage for the day, after which he heads straight to the ambulance, but not before some hearty chat with colleagues. Then, it's all systems go.
Initially, when I joined EMS, when I joined E+, it was a challenge to a point whereby before your spouse gets to understand how you work and how the setup of your work is, it was a challenge. To a point, it would bring a conflict because sometimes you're not even assured if you'll go back home.
COVID-19 poses a real threat to frontline workers globally. Ambulance operators who play the crucial role of rushing health personnel to the scene and evacuating suspected cases to isolation centers take each day as it comes.
COVID, whatever you try to minimize is much contact with the patients. But then you'll have to do your full PPEs for you to be safe. Have your full PPEs. Also, we do a lot of trainings on donning and doffing so that you don't contaminate yourself whenever you're donning and whenever you're doffing. Because that is the level where most of the contamination will come in.
His explanation is suddenly interrupted. An emergency call comes in.
I'm informed that there's a trailer that has fallen down in the process of falling on a lady.
The response is swift. With sirens blaring, the ambulance team sets off. Speed is of the essence, and so is safe driving. Finally, the team arrives at the scene of an accident. The driver of a trailer lost control and rammed into some pedestrians.
We are currently at an accident scene, and for the first responders, ambulance drivers, the medics, paramedics, this is just part of their daily lives. Sometimes it's traumatic to them, but they do it for the sake of humanity. They do it to serve humanity. And today, unfortunately, a life has been lost here, and the survivors are being attended to.
Joshua's body language speaks volumes. He is crestfallen at the loss of life. He has to deal with such disappointments occasionally in his line of work.
E+ has an arranged counseling with experts, whereby you organize for counseling sessions for you to be able to overcome whatever you have seen and whatever you've gone through.
The ambulance crews put their lives in danger to save others. This is what it means to be a hero in society. This is what it means to leave behind a strong professional legacy. Their courage, selflessness, and dedication are humbling, to say the least. Nick Mudimba, CGTN, Nairobi, Kenya.